Dr. Emily Landon. She is the Chief Infectious Disease Epidemiologist at the University of Chicago Medicine. There she is. Good evening. Hello.
Hi.
Okay, so let's start talking about this because people are now heading out. They're also seeing that the number of confirmed cases are going down. So do you worry that people may not be as careful as they were, say, back in April or May?
Yeah, I think there's a good chance that some people are going to be a bit too gung-ho and other people are going to be a bit too timid.
Wondering about restaurants, 25% capacity, 50 people indoors, 100 people outside for other types of venues. Why are those numbers the right numbers for now?
Well, I think we have to have some numbers. And really, I would look at the percent occupancy as sort of the key measure. For individuals trying to judge whether or not something is good is sort of appropriate for them, I would take, we all kind of have a busyness level at which we would say it's too crowded and we need to go home. Cut that in half and then cut that in half again. And then you should get a good idea about what kind of situations you want to be in.
Interesting. As you see some of these numbers increase in places like Florida, how worried about you that something like that may happen here and that we may see what, many people have referred to as a second wave?
Yeah, so far, Illinois has done a wonderful job. And a lot of that is because people in Illinois really do listen to experts and listen to instructions. As long as we keep following the rules and we keep giving people the space and distance they need, and definitely wearing those face masks all the time when you're out of the house and near other people, that's going to make a big difference and go a really long way toward protecting us from having that kind of resurgence. But to be honest with you, we just don't know exactly what to expect from COVID. And so it's extremely important that everyone who has a high risk for a bad outcome continue to be extra careful. People who live with people who are vulnerable need to take extra precautions. And then if you are sick or if you think you may have been exposed, it's important to get testing and to reach out to your doctor if you need extra help.
Emily, playgrounds in Chicago are going to remain closed. Obviously, you can't social distance on the playground. What about schools? Looking ahead, what's the risk there?
Well, phase 4 does allow for the reopening of schools, and I think everyone is excited for our kids to be able to go back to their classrooms. But things may not look exactly the same when they go back in the fall. If we are able to keep the rates as low as we are right now, then it looks like kids will be able to go back, but school's going to look really different. I'm working with the University of Chicago lab schools right now and some charter schools to help them figure out how to navigate what that's going to look like. And I think those plans are coming together.
Okay, before you go, I want to ask you about this Italian specialist in the last few weeks who has said that maybe COVID, the virus, is not as strong right now as it was perhaps back in April or at the beginning of the year. What do you make of things like that and comments like that?
I don't think that's what we're seeing in Florida, in Arizona, in Texas. And I think that if we pinned our hopes on one errant or sort of out of the normal comment like that, it would be probably going the wrong way. Most of us are seeing that people are still getting pretty sick from COVID. We've just done a really good job in Illinois of wearing our masks, keeping our distance, staying home when we need to, washing our hands. And if we keep doing those things, we should hopefully be able to sail through this period, although it'll last a while.
Keep the numbers pretty steady as they have been.
Emily, I'm wondering if it will be possible to go to football games, the large events, concerts, even obviously we're not going to enter phase 5 until we have the vaccine. Is that at all possible if we sit 6 feet apart at a giant football stadium?
Yeah, I think that there is a case to be made for increasing, sort of doing percent occupancies at some of these larger venues once we have a little bit more experience under our belt about things like zoos and restaurants, and we see how our behavior and the virus interact in the real world. We don't have a ton of knowledge about that yet, and we need to sort of gather some evidence before anybody's willing to allow those things to happen. Certainly, we'll gather a lot of information from the protests that we've had about outdoor events with lots of people.
I was just going to ask you about that because we saw those protests a few weeks ago and everyone, I think, was expecting the numbers to maybe increase, the confirmed cases, and we haven't really seen that. Why do you think that is?
I think that there's a good chance that many of the people who were protesting were younger and healthier, and they are the same people who may not come to attention when they have COVID. So they may be less symptomatic, they may not be sick enough to seek out a test or visit their doctor. And so it can take a couple of incubation periods to really see how that spreads to others, individuals in their communities. I'm really hoping that enough people were wearing masks, that the events were happening outside, and that people were really responsible afterwards and are sort of keeping to themselves for a good week or two afterwards and getting tested in order to help prevent any spread to vulnerable individuals. If that happened, then I would say it seems like it worked, but we won't know for another 2 or 3 more weeks. You need a couple of incubation periods.
That makes sense. Okay. Dr. Emily Landon, epidemiologist over at the University of Chicago Medicine. We always appreciate your time. Thank you so much.
Thank you.